Hello everyone, my name is Phyllis Walker and tonight I will be showing you how to insert a catheter. Okay, first of all, in a real situation I would not be talking while inserting this, but considering that I don't really have a patient, it is okay to talk. And this cup is going to be considered my patient since I don't have a real person, and that'd be kind of obscene to be doing this on a real person. Okay, first of all I have a catheter kit and it's right here, and I'm just going to open it. And I will take you step by step of this process. Okay, so first thing with catheter kits, you open the first tab away from you, and then you have these two left and right sided tabs, and then you have the back one you pull open. Okay, now everything inside of here is considered sterile, meaning that it is completely germ-free, and in order to be able to touch it, other than this pack of gloves, which I'm not going to use because these won't fit my hand, you have to have sterile gloves on. Well, it just so happens that I have a pair of sterile gloves right here that fit me. Okay, so I'll show you how to put these on, and this is a very important part. You open them up, and it tells you this side is for your left hand and this side is for your right hand. You always want to put your dominant hand on first, and there's a certain way you can touch these. You cannot touch the outside of them unless you are sterile. You can only touch the inside. So first, with this right hand, I need to grab that outside, so I'm not touching the sterile part. And then I have to slip my hand in there. And these are very tricky to get on sometimes. Okay, we got that on. And then this part, since this is a sterile glove, I can touch any and every part of this glove, this left-handed glove that I want. So I pull this up, and I slide this one on. And you see, sometimes it's hard, but as long as it's sterile to sterile, I'm good to fix it up. And these are sterile. The middle part of this paper right here, since the sterile gloves is there, is sterile. So I'm going to take that and move that away since I no longer need it. Okay, everything inside of here is sterile. So the first thing that you open up and you see is this sheet. And this, you open up and you lay it flat with the white part down, so the blue shiny part is up for in between your patient's legs. And I'll try and keep it as non-graphic as I can. And the second part you'll see that we have in here are the swabs. These have antiseptic. These are benzoyl chloride swabs. These help make sure that if there's any germs on your patient that they get killed, so that way you can insert this catheter without getting germs inside of your patients. And the most important thing about that is whenever you don't follow these directions very carefully or something goes wrong, your patient will get a urinary tract infection from inserting of the catheter. And whenever this happens, it takes antibiotics and longer hospital stays and everything else. And the hospital has to pay for all this because it wouldn't have happened if the nursing staff would have done what they were supposed to when doing the catheter. So you have three. One goes on the left side of your patient and you drop it in the trash. One goes down the right side of your patient and you drop it in the trash. And one goes straight down the middle of your patient and you drop it in the trash. Only one down, and one down. And I'm obviously doing as if I had a female patient. And the next thing in here would be my lubrication. And this is the catheter. This is the end that will be inserted, and this is the end where the urine would come out. And you want to make sure that you lube these things up very good because nobody wants to have these inserted without any lubrication. So you lube it up very good, and you can toss that in the trash. Okay, and for anyone who's wondering, you do not get medicated whenever anyone inserts a catheter on you. Okay. And so this would be my patient, and I would have them laying up, and my left hand would be dedicated to holding them and making sure I can see where I'm inserting this catheter. And I would tell them to take a deep breath in and slowly push it, and you just keep pushing and pushing and pushing. Obviously this isn't going to go all the way in. And then you would allow the urine to drain into this bin. And then you secure it, or if it's an in and out like this one, you can take it out whenever you're done draining the urine and just sit it right there, and it can measure it. And in here there's also a cup in case you needed to collect a urine specimen. And it is very important that you know these steps as a nurse to be able to effectively take care of your patients and cause less harm to your patients, because you don't want to be the person who causes them to get an infection. And then whenever you're done, you take off your sterile gloves without touching. I don't have to touch anything. You take this hand and you slide it up under the bottom because that bottom didn't get dirty. And then you're done. And your patient is happy and you are happy, and there are no infections caused by the hospital staff. So there's your quick lesson on how to insert a catheter. Thank you.